I am so excited to present our first speaker, Dr. Jordan Morton, naturopath physician. He is going to talk to us about sleep, breath work, and de-stressing, which we all need right now. But before I give him the floor, I just wanted to share the story about Jordan and how I met him. So back in September, I succumbed to a back injury and I was in the hospital for 4 days. And after I came out of the hospital, I could not walk. And I tried all different things. And I decided to, I went to BackFit, and that's where Jordan works out of. And one of the doctors said I need to try Jordan, and I did. And Jordan did IMS on my back, my glutes, and my leg. And I'm kid you not, I was walking the next day. I could not walk for 3.5 weeks. I tried so much. And what he did with my IMS, I didn't even really know what it was. My legs started to move. I could walk. I could put pressure on it, and I just was incredibly grateful for that, Jordan. So I could not be happier to introduce to you Dr. Jordan Morton. Welcome, Jordan.
Hi. Yeah, I think I'm going.
Yeah. Thank you for being here.
Oh, my pleasure. And thank you so much for the introduction. You're absolutely the best. And it was so much fun getting to know you and working with you. And yeah, you are just wonderful. So thank you so much for hosting this event and asking me to come speak. I'm super excited about it. And thanks to Victoria Women's Transition House for all the amazing work they do. So yeah, when you sent me the email and I read up about this event and what you guys are doing, I was just like, I couldn't say no. This is so cool. So thank you so much.
Well, thank you. Thank you so much. So I'm going to give you the floor. I'm going to mute myself, and I'm excited to hear you share all of the stress, sleep, and breathing. Thank you.
Oh, sounds good. Thanks. So yeah, stress, sleep, and breathing. 3 things that are pretty big in my practice. So just so everybody knows, I'm going to cue Whitney to go to the next slide as we're going here. So let's go to the next slide. We'll see how we do with this. Awesome. So that's me. I'm a naturopathic doctor. I practice here in town at BackFit Clinic. Yeah, up at Cook and Quadra, Cloverdale intersection there. I graduated from the Boucher Institute of Naturopathic Medicine in 2016. I went to UVic. I love teaching and practicing yoga. My practice is primarily musculoskeletal. So what Tanya was saying, lots of IMS. I do lots of regenerative injections like prolotherapy and PRP. I love talking plant-based nutrition, and then also doing some of these like fundamental naturopathic things like working on stress, sleep. Well, and I teach a lot of people breathing too, because a lot of people don't know how to breathe, interestingly enough, which we will get into. Other than that, I kind of consider myself like a basic Victoria guy. I love running, getting outside, hiking, playing hockey, yoga, vegan food, surfing, recently getting into that. So it's kind of what I do in my spare time. Let's go to the next slide. So why are these important and what is the connection? 2020 has been a tough one. I wasn't sure what picture to put up to symbolize 2020 being on fire. I thought was kind of appropriate. You've seen some other memes with like 2020 being a dumpster fire and stuff like that. Lots of good laughs making fun of how bad this year is, but really, it's been a tough one for a lot of people. There's been lots of changes. People are working from home. People have lost jobs. There's been a ton going on this year. So stress is high. And whether we're feeling that as an individual or we're kind of feeling the cumulative stress as a society, there's just a lot. People are just kind of up here. We're all kind of revved high and we're all feeling it. So yeah, acute stress, chronic stress, it's a big, big topic right now. So if you haven't noticed it, I would say maybe it's affecting you unconsciously or something a little bit below the surface. But I mean, so many interactions that we're having with people online in the community, it's just been a stressful year on the whole. Yeah, so it's super important for us to get into this right now. Let's go to the next slide. So what can we do to de-stress? It'd be great if we could head to a tropical paradise like this one. But travel is limited right now, as we all know. So we're not headed to Hawaii. We are not headed to Mexico. We're not really going anywhere. So we really need to figure out things that we can do at home on our own to de-stress and kind of bring ourselves out of this sympathetic dominant state, which I'll get into, and bring us a little bit more into the rest, relax, recover sort of state that we really do need to be in. So there's a ton of options that people can utilize for de-stressing. Sleep, breathing, nature, exercise, nutrition, counseling, focusing on our relationships with friends and family, and herbal medicine, which I think my friend Amelia is going to get into later on today. I hope she mentions some calming, relaxing herbs, because it's a wonderful big world with that. So yeah, there's a ton of stuff that we can do with it. Sleep and breathing tie in because I really feel like they're two of the best tools that we have to de-stress if we do them right. And they're two things that I find a lot of people struggle with. Tons of people right now are waking up at like 3 to 4 a.m., which in Chinese medicine corresponds with stressful periods, corresponds to the liver meridian. So people are waking up and they're kind of like wide awake at 4 a.m. and they don't know why, but their mind is racing. They're thinking about all sorts of stuff. And yeah, Amelia. And yeah, there's a lot of things going on in our minds right now. So we need to figure out some things we can do to de-stress. You're up before, yeah. Oh, also, I will try to pay attention to the comments there. I had to use my phone for this, so I don't have like the proper chat box, but I'll try to see the questions and respond sort of as we're going. So breathing also is something that I think a lot of people are doing wrong, which I'll get into. But a lot of people are really kind of like breathing up in the chest. We're not taking deep breaths. We're not engaging our breath in the proper way to actually bring us into a bit more of a rest and digest, relax, parasympathetic state. So these are two things that I really do think that we can focus on to help ourselves out. Let's move on to the next slide. So stress. Why do we care? Why is it important? What's wrong with being stressed all the time? I know it probably sounds like a little bit of a dumb question, but I think it's worth examining. It's like, why is it a bad thing if we wake up and we're already in fight or flight mode, and then we are just like kind of irritated and aggravated all day, and then we come home and we're checking our emails late into the night, and then we're going to bed still sort of like wound up and not feeling very good? It's a problem because we are really meant to experience stress in short bursts for a limited amount of time so that we can then sort of come back to our baseline and recover. The classic example is of the caveman that's getting chased by a saber-toothed tiger, right? So like he gets his hit of adrenaline and cortisol and he races off and he makes his escape, and then he gets back to his cave and he can sort of like relax, de-stress, know that he's safe and feel good again. So we're supposed to engage this sympathetic side of our nervous system. That is our fight, flight, or freeze side, just for a short period of time, and then come back to the parasympathetic side of our nervous system, rest, digest, and recover, so that we can actually, maintain good, proper physiological function and be in a good, balanced state of health. So those are the two sides to our nervous system, sympathetic and parasympathetic. And we really need to make sure that we're trying to focus on getting into the parasympathetic a lot more than the sympathetic. Right now, currently, I think a lot of people are living in that sympathetic driven kind of state. Whether we are constantly checking the news cycle, maybe we're watching for updates from Bonnie Henry every single day at 3 p.m. like I am. I'm kind of addicted to that. The coronavirus is taking up a lot of our time, energy, and effort. But on top of that, we have our cell phones. Maybe some of us have seen that documentary, The Social Dilemma. Like we are constantly looking at Instagram and Facebook and Twitter, and we are comparing ourselves to other people, and there's constant updates. We have a flood of information coming at us 24/7. We have work emails coming in late at night. We are constantly go, go, go. This state of FOMO as well. Like we're looking at people who are doing fun things, and we're like berating ourselves because we're not out there having fun and living our best lives. And we get stressed. We're stressed about so many things all the time. So I really do think that too many people are in a sympathetic dominant state, and we really do need to try and bring ourselves down into this parasympathetic state. So let's go to the next slide. So we have probably all heard this term burnout. Some people just talk about adrenal fatigue or adrenal dysfunction, chronic stress, or the proper term for it is general adaptation syndrome, or like the inability to generally adapt to chronic stress. There's a bunch of different classifications when it comes to stress. Acute, so like the saber-tooth tiger kind of event. Chronic acute, maybe there's a person at work that you really don't get along with, and your interaction every single day just kind of starts to wear you down. And then there's chronic stuff, things that have been happening for years, family issues, issues with friends. Hopefully this coronavirus doesn't become a chronic multi-year thing. Fingers crossed. But yeah, so there's a few different types of stress, and they all add up. And right now, I think that we're experiencing a little bit of them all. So too much of that too many of those stressful scenarios can actually lead to us feeling this sense of burnout and feeling totally depleted. So while adrenal fatigue isn't actually like a diagnostic term, the WHO, World Health Organization, recently did add in burnout to the ICD-11, the International Classification of Diseases. So it's kind of like the textbook of diagnosing physical states. And so it is now a medically accepted term to be burnt out. I think that's super interesting and also very concerning that we now have so much burnout going on throughout the world that we are medically classifying it as a disease. So what happens here with burnout, and why is this an issue? If you look at the graph there, this is a cortisol curve. So our body produces cortisol, and it's actually a crucial part to our health. It's a hormone that's been vilified due to its association with chronic stress, but cortisol helps to control blood sugar levels. It regulates metabolism. It helps to reduce inflammation. It helps with memory formation. So it does a lot of really good things for us. It has a controlling effect on blood pressure, helping with your water and salt retention. So like it does a lot of good things, but if it's elevated for too long, that's where we run into issues. So the way that cortisol is supposed to work is we should get a spike in the morning, roughly an hour before we wake up, and then it should taper off throughout the day. That spike in the morning gets us up, we're out of bed, we're energized, we're ready to go, and then throughout the day it starts to go down so that by 8, 9 p.m. it's low enough so that we're ready to hit the hay. It also works with melatonin. So as your cortisol goes down, your melatonin should be going up, and they kind of work together to put us to sleep. What happens though with a lot of people is that when they're experiencing too many acute episodes of stress or have too much chronic stress, their cortisol curve gets a little wonky. And so you sometimes will see people who start flat in the morning, and these are the people that have a really hard time waking up. They need like 6 cups of coffee, and then slowly throughout the day, their cortisol sort of ramps up. And then by 7 or 8 p.m., they're laying in bed and they're just like, why can't I sleep? I'm exhausted, but I can't sleep. We call that wired and tired, and that is something that we really need to work on. The other one is somebody who comes into my office and they literally look like they have been like wheelbarrowed there. They have absolutely no energy. They're totally zapped, and they have no cortisol whatsoever. And on their curve, you see it just like flatlined. So we can actually test this. You can do salivary tests, and you can see what your cortisol levels are like throughout the day. So it's a 4-point thing: morning, mid-morning, afternoon, and night. And you can see if you're healthily producing cortisol or if you are sort of out of whack. Let's go to the next slide. So cortisol, while it's crucial, if it's elevated, it does lead to a lot of problems. And I've got this picture here showing that. It can cause weight gain, mood swings, anxiety, fatigue, that tired but wired sensation, irregular menses and fertility problems, libido changes, suppressed immune system, high blood pressure, skin issues. So not good, right? Cortisol is a major communicator in the body, so it works on tons of different systems. So when it is out of control or it's dysregulated, you're going to see systemic kind of issues. Chronic stress itself has been linked to all sorts of different issues: depression, fatigue, apathy, headaches, IBS and digestive problems, hypertension, cardiovascular disease, obesity, diabetes, sleep deprivation, immunodysfunction, all sorts of different things. So the other problem is that when we're stressed, we'll make poor nutrition choices. We drink alcohol, use other substances. So it's just a recipe for disaster and poor health. Sorry to start this off with all the stressful things and getting us stressed out about stress, but I really just want to make the case clear that stress is an important thing to focus on. Let's go to the next slide and we'll start talking about what we can do. So one thing, and you're probably wondering why I have a picture of a zebra here doing a little shake. one thing that we don't do as humans anymore, and people think that we did used to do, is this shake. So if you ever watch your dog or your cat or any other animal out in nature, whenever they have a stressful experience, oftentimes they'll give a little like a little shake after they have something stressful happen, whether it's like a near-death experience, escaping from a tiger or something like that, or just even my cat when he like bumps into a chair or something when he's running around. They give like a little shake, they reset, and then they're all good. So the reason that they do this is because it helps to reset their nervous system and bring them back to their homeostasis and kind of bring them back to baseline. A lot of people think that humans don't do this anymore just because for like millennia, we have been told to just kind of like suck it up, to not be crybabies, to not like, really air out our grievances and stuff like that. And oftentimes when we do that, things get suppressed and we put them into our mind and we put them into our body. And oftentimes that is where depression, anxiety, chronic pain stuff stems from. A lot of it is a mental emotional aspect that we internalize. So the shake is a really big thing. And if you haven't done a good shake in a while, seriously, like just stand up and do 15 seconds of just sort of jumping around, moving, shaking your body, doing a couple of squats, whatever you want, just to sort of move and shake and let go of some of that stress. I think that it's a good thing to do at least once a day. Like maybe it's when you finish work, maybe it's after you get off a stressful phone call, whatever it is, just like shake it out, do your best Taylor Swift kind of thing. Is it shake it out? Yeah, do that. And just really use that to de-stress. It's an awesome thing. And if you're interested in more about the mind-body connection to stress and physical trauma and mental emotional issues, there's 2 books that I recommend: Why Zebras Don't Get Ulcers and Waking the Tiger. So both really, really cool, interesting reads. And if you're interested in this stuff, pick them up. Okay, next slide. So breathing. Seems simple. We're all like, yeah, I can breathe. What's the big deal? The issue is that I often find people don't breathe properly. They're not using all of their lungs. They're not engaging their diaphragm. People are mouth breathing too much. And so aside from the obvious thing that breathing is important to stay alive and deliver oxygen throughout the body, we can use it to de-stress, and we can actually use it to get into the parasympathetic state. So we all know the basics of breathing. You breathe in, you breathe out. Super easy, right? I first learned about diving a little bit deeper into breath work when I did my yoga teacher training about 10 years ago. Part of the process was getting into yoga pranayama and doing, thank you, Tanya, putting the book recommendation there. So doing yoga pranayama and actually focusing on like alternate nostril breathing, using forced inhalations and exhalations, breath holds, using my breath to open my body up to get a little bit deeper into postures, all sorts of cool things you can do with the breath when it comes to yoga, but all sorts of cool things you can do with the breath when it comes to relaxing. So if you have a breath practice already, that is awesome. If you don't, we're going to explore a couple of options here for you. And I'm going to dive into why carbon dioxide, some people think, is actually more important than oxygen. So let's go to the next slide. The other book was Waking the Tiger. I think it's by Peter Levine. So, okay, nasal breathing. It does so much for us. The one thing, this always makes me laugh. I don't know if anybody watches Stranger Things, but I always think about Eleven calling people mouth breather as a sick burn. And it just, makes me laugh thinking about it, because nasal breathing is actually such an important thing for us to do. It humidifies and it warms the air that we breathe in. Breathing through our nose also helps to filter the air. So taking out particulates and sorts of different things. It makes air easier for our lungs to utilize, I'll say. It actually facilitates delivery of oxygen to tissue. And this one's super neat. When we breathe in and out of our nose, it actually creates more nitric oxide. Nitric oxide is something that helps to vasodilate, open up our blood vessels, and more efficiently delivers oxygen to our tissues. Also, when we breathe in and out of our nose, typically it's a little bit longer of an inhale and exhale. And when we do that, we increase the amount of carbon dioxide in our blood. So the concentration of carbon dioxide goes up a little bit. And what that does is it displaces oxygen from the red blood cell so that it's easier to get into the tissue. So a lot of people worry about their carbon dioxide concentration getting too high if they start to hyperventilate or something. Hyperventilating is a little bit different. In this scenario, we are just like subtly increasing the carbon dioxide concentration so that it is shuttling oxygen from the red blood cell into the tissue where it can be metabolically active. So it makes a big difference actually if we're breathing in and out of our nose. I've been recommending this a ton lately. I've been recommending people try mouth taping. So you put a thin strip over your mouth. It encourages you to start working with breathing in and out of your nose. You can use it while you're sitting at your desk at work. You can use it when you go to sleep. Oftentimes I'll even wake up, like I'll do it at night and then wake up and the piece of table be ripped off and on my bedside table, but I still try. Some nights I get all the way through, some nights I don't. The nostrils themselves, this is super interesting and not a lot of people know this. Each one is linked to a different side of our nervous system. So the left nostril is linked to our parasympathetic side and the right nostril is linked to our sympathetic side. So if we are looking to de-stress, breathing in and out of the left nostril will actually bring us down and help us to relax. If you're looking to kind of get like fired up and ready for something, breathing in and out of the right nostril will get you revved up and increase that sympathetic tone. Let's go to the next slide. So symmetrical breathing is something that's really important too. There's a fascinating book called Breath by James Nestor, and this book like changed my world this year. It absolutely blew me away. He gets into what the most efficient form of breathing is, and when we look at the science and when we look at the physiological changes that happen when we start breathing properly, it's a big difference maker between our heart rate variability, which is a good indicator of overall health, and also of oxygen concentration and oxygen delivery into the tissues. So what they found is that about 5.5 breaths per minute is going to be your ideal way of breathing. The average person is about 12 to 16 breaths per minute. Babies are quite a bit faster, but for your average adult, 12 to 16. So we need to slow it down like, big time. This works out to about a 5 to 6 second inhale and exhale, which if you do it now, like is quite a bit longer than what we're used to. So even if you're just sitting, doing work, listening to me, try to do your inhales nice, even and smoothly. 5 or 6 seconds in, 5 or 6 seconds out. Okay, let's go on to the next slide. So the symmetrical breathing is a nice thing to be doing every single day. And then developing a breathing practice where you have 5 or 10 minutes of dedicated time throughout the day to focus on your breathing is another wonderful one. There's tons of different breathing exercises out there. Yoga, pranayama, Wim Hof, if you haven't explored him before, the Iceman, Wim Hof, he's got some pretty radical stuff. Alternate nostril breathing, Buteyko breathing, and then the one that I recommend the most to people is box breathing. So box breathing, because it is such a simple, straightforward one. And if you're feeling like anxiety or stress or something kind of starting to well up, you can just do 4 rounds of this breathing and it helps to bring you right down. So it's super simple. 4 seconds in, hold for 4 seconds, 4 seconds out, hold for 4 seconds, do 4 rounds. It is so simple and straightforward. I recommend this to kids, teenagers, adults, anybody and everybody. And it almost always helps people calm down. You pick something to focus on. Maybe it's the tip of your nose, maybe it's the back of your throat, maybe it is your chest. Choose somewhere in the body that you can really focus on the physical sensation of what's going on. All of your attention goes there as you breathe, and I kid you not, you will calm right down if you're having some form of stress or anxiety kind of welling up in you. So if you've got time right now, which if you're watching this, you probably do, try it out. 4 seconds in, hold for 4 seconds, 4 seconds out, hold for 4 seconds, and give it a shot. So let's move on. Deep breathing. This is one that we've been doing with all of our breaths. I find that people don't use all their lungs. Oftentimes people really kind of get caught up top here and they're taking little shallow breaths, breathing like that. That is going to cause you to stress out, just in the same way that deep, slow, relaxed breathing is going to cause you to calm down. So we can consider this a form of biohacking, right? Like I don't love that term, but it sort of works here. When we're taking nice, deep, slow, conscious breaths, there's no way that we could be being chased by a tiger or something like that, right? So we're telling our body, things are okay. We can breathe right now. We're slowing down. We're taking deep, calming breaths. Everything's all right. if we're breathing like this, we're telling our body, oh man, something's happening. Like we got to be in panic mode and survival mode here. Like we got to get moving. So deep breathing, really engaging your diaphragm, trying to bring air as deep into the lungs as possible. Something that I think everybody should do. So that's like, these are quick primers on breathing. There's a lot more. If you're interested in breathing, check out that book, Breath by James Nestor. But I do hope that I've communicated how important breathing is. So, let's move on. Next slide. Sleep. So everybody probably agrees that sleep is important. And sorry, before I do this, Tanya, I see that it's 11:30 right now. If I go to like 11:35 or 7, am I okay? Yes, okay, great. So sleep is super important, obviously. I say this quite a bit, but if we could encapsulate sleep and put it into a supplement or a pill form, it would be by far and away the most popular and most lucrative kind of thing that you could even imagine. Just think about when you have a poor sleep versus when you have a good sleep. You have a poor sleep and you wake up and you're just like, oh my God, like, how am I supposed to do anything today? I feel so terrible and so tired. Everything is a struggle. My brain is moving, at like 1/10 of the speed that it should. I think negatively about everything. A poor sleep really sets you back for the day. Versus those days where you wake up after like a clean 8.5 hours of deep sleep and you are feeling good. Oh, so kids waking up at night, that complicates things, I will say. Being a parent and having young kids makes things very difficult when it comes to sleep. So no, I don't touch on that here, but we can chat about that sometime if you want, for sure. Having a good deep sleep though, when you wake up and you're like feeling 10 out of 10 and you think that you can conquer the world and just absolutely kick so much butt, like it's hard to even put into words how good you can feel after one of those deep recovery sleeps. So if you could have, like I said, a supplement that takes you from A to B like that, it would be game changing for a lot of people. So sleep is just so important. Another book that I read this year that if you're into sleep, I think is worth reading is called Why We Sleep by Matthew Walker. He's got a couple wonderful TED Talks as well. It's also an audiobook, and he's got this lovely British accent that lulls you to sleep. It's so nice. So if you're interested in sleep, Why We Sleep is something you should get into. And it's kind of what got me going down this path and getting really passionate about sleep. So let's go to the next slide. So the big overarching theme is that a shorter sleep predicts a shorter life, and it is a non-negotiable biological necessity. So it sounds pretty important, right? Quality sleep is linked with better energy, enhanced creativity and concentration, lower blood pressure, better mood regulation, so we're able to deal with stress a lot better, higher immunity, and better fertility. Lack of sleep, it increases our risk for anxiety, obesity, depression, stroke, cancer, heart attack, diabetes, chronic pain, Alzheimer's, and neurodegenerative diseases. So yeah, focusing on sleep is kind of important. When it comes to stress and anxiety, which 2020 has been full of, sleep plays a super important role. Maybe some of you actually slept more this year since we have less social events and less commitments to be doing. Like I know I have. I've actually increased my sleep probably by about 45 minutes to an hour per night, which has been amazing. I'm absolutely loving it. But lots of individuals have found themselves sleeping less, tossing and turning. We call it the monkey mind, just like racing and racing, spinning around. And then that little visit from Mr. Sandman never happens, and you either sleep a little or don't sleep at all. The interesting thing about sleep is it allows us to have a really active and refreshed prefrontal cortex. So this part of your brain right up here at the front, it is important for executive function, making really smart and thoughtful decisions. And it also helps us to deal with emotions coming from the deeper part of our brain called the amygdala. So if we don't have a refreshed prefrontal cortex and we feel like we are stressed out, like we've been having this year, we're going to have a harder time dealing with it. So sleep is crucial when it comes to dealing with stress and anxiety. When the brain is, that day that you have a bad sleep, like you wake up and you're just kind of grumpy and everyone's a jerk and you don't want to deal with anybody and you're sitting there just binging on ice cream, that's not you. That is the bad sleep, and that is your brain trying to cope with what happened last night. So give yourself a break and try to reset so that tonight you get a really good sleep. When that happens night after night after night, Sometimes people get really stressed out about it because sleep deprivation is a terrible thing, and we really start to have some problems. But you can get back to having a normal, healthy, natural sleep cycle and feel like a rock star again once you get back into a good routine and start getting some sleep. So how do we rectify this? How do we focus more on getting good sleep versus this bad sleep? Okay, let's roll into the next slide. First off, like by far and away are screens and blue light. We're talking cell phones, TVs, laptops, tablets, video games. I'm sure there's other stuff that I'm not thinking of, but blue light really does disrupt our circadian rhythm. As nighttime comes in and the light, natural light, starts to decrease, we start to increase our melatonin production, and that's what kind of gets us ready for bed. If we have blue lights in front of us and we're staring at our cell phone and we're looking at work emails and we're thinking about all this stuff, it disrupts melatonin production and it increases our cortisol. So we're literally preventing ourselves from getting ready to doze off when we're doing this. The brain perceives it as daytime and it's going to stop us from going to sleep. So we don't want this. Like, definitely not. You need to focus on putting your devices away at least an hour before you want to be in bed. I recommend 2 to 3 hours. Like, if you can not watch TV or not look at your cell phone, that's for the best. Like, I'm guilty of this. I'll watch Netflix and I'll be on my phone and stuff like that. But I do notice how much better my sleep is when I focus on these things. One really interesting thing that you could think about picking up is something called a blue blocking lens. So blue blockers are a type of glass spectacles that you can have that actually blocks that wavelength. So they help, but they're not perfect. The best thing you can do is put it away. So next slide. Routine. Seriously, we are just like oversized toddlers. Our bodies love routine. You should be doing the same thing every day, like every morning and every night, so that your body gets the cues about when you should be going to sleep and when you should be waking up. So a bedtime routine is crucial. Have your tea, do a little journaling, have a little stretch, have a read, have a bath, like whatever you want. You don't have to complicate it. Just a few small things so that your body gets the hint, like, oh, we're powering down, we're getting ready for sleep. Let's do this. In the mornings, I recommend that people get up and get moving a little bit just to get that cortisol up in the morning naturally. I mean, it's so dark right now. I actually think people benefit from getting one of those light lamps. It's like a sad lamp. I think those are brilliant in the morning, a little something to actually get you up and moving. So yeah, routine makes a big, big difference. Don't think that you're special because you're an adult. You need a routine just like an infant and a baby and a kid needs a routine. Let's go to the next slide. Sleep hygiene, sleep habitat, these are all so important. I was living downtown 3 years ago, I guess it was, and we were like right in the thick of it, and we had trucks coming by our window at 5:30 in the morning, picking up garbage. Like, we had bright lights shining in on us, and it just ruined me. Like, it was awful. I had bad sleeps. I was not functioning at my best. And when we moved and we got blackout curtains, like, you know, the ones that completely stop any light from coming in, and I started using earplugs, my sleeps have been phenomenal, and it makes a world of difference. So examine the room that you sleep in. Is it bright or is it dark? Is it quiet or is it loud? There's some things that we can do to help out with this. Like I said, earplugs help. White noise machines help. One of the biggest things that most people actually struggle with, though, are pets in the room. So we love our cat, Bailey. He is wonderful, but he gets kicked out every single night because he thinks that the best place to sleep is on top of our heads. And he'll go from head to head like 5 times a night and then ruin everyone's sleep. And it's awful. So kick the pets out of the room. Yeah, let's go to the next slide. There are some other ideas that you can implement with this. So exercise anytime during the day, but ideally more so in the morning is great. Limit your caffeine. Won't kick the kids out of the room. Yeah, that would help. Limit your caffeine, 1 to 2 cups a day. And I typically say no coffee afternoon. Like, just a nice, simple suggestion. Say no to the nightcap. Alcohol does not actually help you sleep. A lot of people think that it helps you sleep. It disrupts your sleep. It might get you to sleep, but you're not going to have as restful of a sleep. You're not going to enter the deeper stages of sleep, and you're going to have less good quality sleep. Or you get a little bit of a rebound after you metabolize the alcohol and you wake up at 2 or 3 a.m. and then you're hooped. So drinking alcohol, while it's kind of, you know, it's common, don't do it if you're trying to get a good sleep. Reconsider your mattress and pillow. This one, it's sadly hilarious, I guess. I don't know. I've had a bunch of people over the years who they think they have back and neck problems, and then they switch out their mattress and pillow, and it resolves almost overnight. It's crazy, but it makes such a big difference. So there's companies out there that do give 100-night warranties where you can try a new mattress for a couple of months or 3 months, I guess, and then if it doesn't work for you, you can send it back. So just something to consider. Herbal medicine, which I said, I hope Amelia touches on this tonight or this afternoon as well. But herbs like passion flower, oats, what else is good? Kava kava, valerian. There's some really nice teas, tinctures, and extracts that you can use to have a good sleep. Naps, I love naps. Nothing like a good nap. Just don't push it too late into the day as to disrupt your sleep later. And try to focus on like 30 to 45 minutes for a good quick power up, and then continue on. So next slide. Sleeping aids. Okay. I touched on the herbs there a little bit, but the other ones people are always sort of curious about are melatonin and then pharmaceuticals. So starting with melatonin, the best evidence for melatonin is to help you with your circadian rhythm when you do like a long haul flight. It helps you to reset that circadian rhythm and get over jet lag. So good research indicates you can use melatonin to adjust to a new time zone. And there's okay research, but nothing too conclusive to say that melatonin is going to act as a good natural sleep aid for you day in, day out. I've got patients that use it and they say that it makes a world of difference. So is it placebo? Is it functional? I don't care, to be honest with you. If they're getting good sleeps, I'm happy. Melatonin is also a fantastic antioxidant, so you're getting some benefit there. Just don't, it's not the magic pill like a lot of people think that it is. Pharmaceuticals. This is a tough one because a lot of people have been prescribed these by their doctors over the years, and they are very, very difficult to come down off of. It's tough. They make a big difference, but the issue is they don't actually give you a good restful sleep. So the hypnotic drugs that people use for sleep, they restrict the deeper brain waves produced during your REM sleep. So you don't enter all the particularly useful stages of sleep. Oftentimes it leads to grogginess and sometimes forgetfulness the next day. People kind of feel like they're in a bit of a zombie mode. That's because of the medications. Feeling sluggish the next day leads to more caffeine use or stimulant use, and then it makes sleep more difficult and it kind of perpetuates the cycle. People become dependent on these and they're really hard to wean off of. Abrupt stopping of those kind of medications is absolutely not advised, and you need to work with somebody to slowly titrate off. Like we're talking over the course of many months to titrate off of these things. There is a rebound effect when you're coming off of it because of like the chemical dependence. So you have to be careful with those if you are using them. Okay. Herbal medicine, a couple other ideas that I have jotted down here. Some other herbs that I think are nice: chamomile, lavender, ashwagandha. They're all great, and we've got some wonderful teas and also herbal medicine dispensaries here in the city that can make you like custom blended teas. I usually recommend people work with either a medical herbalist or a naturopathic doctor because different herbs have different properties, and you can customize things specifically for you depending on what else is going on. So next slide is the end. I tried to pack a bunch into this, and I really hope that there are some things in here that you found useful. The big takeaway is that, well, one, I hope you're not stressed about being stressed because that's a vicious cycle. If you are, there's so many things you can do. Focus on your breathing, focus on your sleep. Reach out to me if you have any other questions or you want to explore some of these options. I'm always happy to chat and be of assistance here. Thank you so much for having me. Once again, this was super cool. And that's my email, drmorton@backfit.ca. And I will also say, I hope that everybody's sticking around because another BackFit doctor, Dr. Megan Yim, is up next, and she's going to give you some hot tips on ergonomics and mobility, and she is just a rock star. So definitely, stay tuned for that one.
Thank you, Jordan. Thank you so much. That was incredible.